Hello, we're doing a small short presentation on some basic pet first aid using our model dog, just to talk about and cover maybe some of the basic things that could happen in the event of you taking care of someone's pet, if not your own. And after you've examined the dog thoroughly and you've checked all of its vital signs and you've identified what the problem is, you then know the right course of action, whether you do need to seek veterinary advice immediately or whether there's something you can do to keep the dog more comfortable or better protected in transit to the vet, or even if you need to see the vet. Now, dogs, just in the general operation of life, can do all sorts of silly things to themselves. They can get stung by insects. Bee stings, particularly if it's around the face of the dog, can be quite uncomfortable. You can get facial swelling. You can get a dog that might look quite serious. Anything that happens like that to the dog, you want to take the dog straight away to the vet. Other little abrasions, wounds, skin infections, or red, weepy looking skin, those are the sorts of things that you really should take your pet straight to the vet and have them examined. A common thing for a pet to do is to cut its feet or injure its foot, particularly the foot pads. So I'd like to show you a really easy, safe way of bandaging an animal's foot, because it's likely it's going to need some type of treatment after that, but you need to keep the wound covered and clean. Now, if you can, on hand in your first aid box, have some little gauze swabs like this, that would be ideal. If you don't, you can use tissue paper, paper towel, even a little piece of cotton or cloth that you might have, a little bit of leftover towel, anything that will provide absorbency. So you want to absorb the moisture or any bleeding or fluid. And you also want something that will cover the wound and protect it and keep it dry. You'll need to make this the size of the dog's foot to cover it as much as you can completely on the underside of the foot. Now, if you can, you might need someone to help you hold the dog. You want to try and apply this to the wound that's bleeding and apply very, very firm pressure. Now, if you can hold that there firmly and at least count to 10, then with that still in place, you want to use some type of bandage, preferably not an adhesive bandage, because using something with a sticky surface is not only going to stick to the fur, but it's going to make it very uncomfortable to get it off. So you want to try to use either a cloth or a simple elastic bandage that doesn't have a sticky side to it. This one that we use here, it actually sticks to itself. It's like a sports wrap. So cover the actual bandage itself. So always starting at the lowest part of the limb and working up towards the heart. And you want to go over and around the dog's foot. You want it to be firm but not tight, and you want to slowly wind that bandage up the leg. Now, if it's just the foot that's been injured, you don't need to go much past halfway up the leg with the bandage. And with these bandages, if you just give them a gentle squeeze, that's enough to make it stick firmly on the foot. Now, if you have a dog that's likely to chew that off or try to get it off because it's uncomfortable, make sure you've got no swelling in the toes. That's an indication that you've put the bandage on too tightly. And make sure that the dog's comfortable. Okay, so most of the time the dog can still walk with this type of a bandage on their foot, and it will just keep it clean and dry and also help absorb any moisture or bleeding. All right, then you still probably need to have it looked at by the vet. Now, in the event of you've come across an unconscious dog, and this can happen for lots of reasons. The dog might have suffered a seizure, It might have overheated. It may have been poisoned. It could be in shock for some other reason. There could be an underlying medical condition that you're not aware of, but you're going to actually come across a dog that's unconscious, or in some cases gasping for breath and unable to do so. So you have to go over your 5-point checklist and check all of the dog's vitals to establish that yes, the dog is indeed unconscious and not breathing, and we'll need then to perform CPR. So I'll bring in my assistant Nicole to assist. So we've established that the dog isn't breathing, but we have a heartbeat. We just need to resuscitate. So the first thing you're going to do is we're going to do a couple of breaths into the dog's nose. When you're breathing into a dog's airways, it's really important that you hold closed all the dog's mouth parts. So as much as you possibly can, use your hands to cup over the whole muzzle of the dog so that there's no air escaping as you're breathing into the dog's nose. You do need to use a fair bit of force to get air all the way down the dog's nose to inflate its lungs. And we're going to do 2 short breaths, and then we're going to apply some compressions. So off we go. Now, each time we've done this, we're going to take a pause. We're going to listen to the heart or feel for the heart. We're going to observe the dog and watch closely to see if we have any rise or fall in the dog to indicate that it's arousing consciousness or that we're bringing the dog back. Once again, you have to be very careful around the mouth. Check the airways. Make sure that there's nothing obstructing the airways down the back of the throat, and continue to do that until such time as you've either reached the veterinarian's doorstep or you've managed to revive the dog, and essentially, like any ambulance officer would, continue that for as long as you possibly can till hopefully you get a response or some medical help. If you've never done this procedure before, which most people haven't, and hopefully you never will, you definitely need to know where is the dog's heart and where is the right place to perform these chest compressions. Now, if you can isolate from the elbow and just move the elbow forward, and then just in behind where that elbow usually sits up against the dog's rib cage, that is where you should find the dog's heart. Different dogs, different sizes, different sized rib cages, some big, some very small. So apply the right amount of pressure for the size of the dog you're working on. Obviously, we'd prefer you to not break any ribs, and making sure that you use the palm of your hand right in up behind that elbow. So actually lifting and moving your dog's leg forward and getting right in behind there on the side wall of the chest.